On this episode of the Ask Mike Reinold Show, we talk about some of our strategies for conserving patient visits in a cash-based physical therapy model. The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Before we get to the podcast, I wanted to make sure you knew about my free online course on the Introduction to Performance Therapy and Training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We're here answering your questions. PT, sports performance, fitness, career advice, anything you want to talk about, head to mikereinold.com, click on that podcast link, and you ask the questions. We answer your questions. It's amazing. I'm here with the crew from Champion PT and Performance today. We have Dave Tilley, Lisa Russell, Lenny Macrina, Dan Pope, Mike Scaduto, joined by no doubt the best physical therapy student we've had all week. Trevor.
Weeks upon weeks of Trevor Lotion Claridge that we just adore, and he's just doing an amazing job with his Tiger Red.
I like that. That's pretty good.
Yeah.
What do you think? What do you think, Trevor? Trevor, tell everybody a little bit about yourself.
I go to PT school in Nashville. I'm from Southern Indiana, and yeah, that's about it. I'm pretty boring. So.
What's your favorite?
Okay.
What's your favorite casserole? Like, what do you like to eat for a casserole?
Hash brown casserole.
Hash brown?
Yeah.
I feel like
any cheese in there?
Speechless.
Cheese?
Speechless.
I feel like as all the therapists here, we all have different relationships with the students, right? Like, I feel like we all learn a little bit something about them. I feel like Mike tends to learn the most nonsense about each physical therapy student. What is it that you talk about all day?
I never know what their future plans are. I never know what they're doing after it, but I know just a little bit about their personal life.
That's
and
right.
Yeah. I use it to my advantage at times.
Well, that's awesome. Now we know what to get you for your going away gift, Trevor. It's going to be a gigantic hash brown.
Hash brown for McDonald's. Can't top that.
Awesome. Trevor, what do we have for a question today?
So Dominique from Phoenix, with Champion being cash-based, how do you typically go about scheduling visits with post-op patients, such as an ACL reconstruction or rotator cuff repair, where they will be there for many months? Are you going less visits initially when the focus is mostly with range of motion, and then begin to ramp up as post-op restrictions ease up?
Solid questions, Dominic. I like it. It sounds like Dominic's starting to plan a little bit, has been working in the insurance model a little bit. So very good questions. I feel like most people have very similar questions with this. I'm going to start it off with this and then let some of you guys jump in a little bit, maybe especially to the PTs that have transitioned from insurance to cash a little bit too, like how you guys manage this a little bit. But I would say the first thing is that don't assume you always have to manage visits. So here's my treatment approach, right? I consider myself an expert at my profession, right? I consider everybody on this Zoom, and probably most of the people that are listening to this are experts at their profession, right? We went through a lot of schooling and education for that. I'm here to provide a service for you. When you come see me, I tell you exactly what I think you should do. You have to figure out if that's financially feasible for you or whatever. If you tell me you can't, right? Or like, oh, we can't, then we can talk about a compromise. But I always start off with, here's what I think's best. And I always tell people, like, I think this is like, let's just say 1 time a week as an example, right? 1 time a week's probably not enough for you. 3 times a week, to be honest with you, you probably don't need that much right now. Let's slot in at 2 times a week. That's like how I would start a conversation. And maybe you're having that for a duration conversation too. But let's start off with just saying is, I want you to do what you think is best and let your patient population tell you if that's feasible financially for them. Realize that in a cash-based setting, you might be a PPO where they get reimbursement. They might have an HSA where they get a tax, rebate for this. They may have a huge deductible and copay. if they went elsewhere. So heck, they would have paid $1,000 anyway. You know what I mean? So like, I guess what I'm getting at is don't assume. That's the first thing you should do, is do what you think's best. And then when you're having an issue with the person, then you talk about how to manage that. That being said, who wants to jump in? Dan, you want to jump in from your experience a little bit on how you manage this?
Yeah, for sure. I guess I just wanted to say first, I don't think it's a bad thing to sell yourself a little bit. I came from that insurance model, and I'm just super frugal as a person. And I think that sometimes I don't value myself, so I'm trying to go out and try to save these guys money before they even want to save money themselves, But the other piece is that you're cash based because you're probably going to be a little bit better for that person, have more time, maybe you have more experience in that niche. You're probably going to do a better job. So I think it's okay to let them know that it's important to do physical therapy at a good place, and it's their health, right? I think people undervalue their own health. And it gets a little bit confusing when people pay insurance and they want to be able to use it. But at the end of the day, health is very, very important. So I think it's good to let your patients know that and let them know they're probably going to have a better experience. To touch on the point that our reader, who was the question asker?
Dominic
Was saying, do you do less visits up front? I used to kind of think this way. I used to sometimes say, if you want to do your early rehab with someone else, a couple of mentors of mine have told me that in the past. You can do your rehab elsewhere and then come here towards the later stages. And that course can work, but you have to assume that the other place you're sending the person to is good, Post-op knees, I know that was one example that you had talked about. If you're not doing the right things early on and trying to maintain, let's say, as much quad as possible, doing things like BFR, making sure you're looking out for red flags, then they're not going to do particularly well. And we end up seeing a lot of those folks later on. And if they had good PT to start, they may not be in that same situation. So I agree with Mike, set the best possible plan of action for the patient and then let them make the decision, because I think all stages of rehab are going to be really important.
Yeah. And I kind of like what you said there. The concept too, let's say ACL reconstruction, which is one of the things that Dominic asked, but even like, rotator cuff repair, stuff like that. Like I almost think the opposite. I don't want them to get behind. I want them to be on pace. I want them to do a really good job at the beginning. I almost want to see more at the beginning and less towards the end. And then when they get to the progressive loading phase, that is something they can do a little bit easier on their own, or they can do in a supervised environment, or even just refer to like a gym-based setting or a fitness professional that you collaborate with. I'd almost kind of flip that a little bit, but I don't know, good stuff. But let me see, Mike, do you have some thoughts?
Yeah, I would say, even in a cash-based setting, and even though we have direct access to PT in Massachusetts, oftentimes these people have a physical therapy prescription from their doctor that says 2 to 3 times a week for post-op care. So I think a lot of them are expecting to come in 2 to 3 times a week after they just had surgery. And then if you say, oh, no, I think you only need to come in once, like they kind of look at you like they're a little bit confused. So I think, getting an idea of what their mindset is going in, setting the expectation. And if they came to see you for their first post-op visit with a script from the doctor, assuming they're going to come in 2 to 3 times a week, and you think that's, what they should be doing, then I think you should value yourself and not try to dissuade them or not try to talk them out of, doing that just because it's maybe financially a little bit more expensive for them.
I like it. What's up, Dave?
Yeah, I just wrote a blog post on this, and we kind of talked about this, not the cash-based aspect, but just the how important the first 6 weeks are that Mike and Dan have mentioned. I think it's critical to set the tone for rehab, especially with a cuff or an ACL, like the big surgeries where you need to get motion going and get them established and get their pain down. If you try to undercut them and only do once a week, you may set things up for a long road of trying to get their motion back and their pain under control. So I would front load them a little, and then they see the value and they get their motion back and they start feeling good. So I definitely think what we've said is critical to kind of flip your thoughts, Dominic, or Dominique, whatever their name is.
Mike, did you have a little more? I know Dave wants to jump in.
Yeah, go ahead, Dave.
I feel like you guys were conversing.
Yeah.
It's quick. Mine is just that, like, my 2 cents is what I've learned from Lenny and Mike and everybody else is like, we're not uncomfortable having that conversation about time or money or finance and stuff like that. And I think that's the only time it becomes weird is when you're dancing on eggshells and you don't want to talk about it. And the person's asking you like, oh yeah, well maybe we could do this. But like, you just tell people straight up, like, Mike has said it before, but like, we don't want to waste your time nor your money, but like after surgery, you need, that's where my expertise and you can't range your own arm. You have precautions and limitations and you don't know what motions might be irritating what structures. And so those are really, really important, you know, barriers and things that people have, is to not understand that. And I think that's where one of our biggest roles as PTs come in is, one, the hands-on skills, but two is the education, because people are really like nervous. They're really scared about, you know, is this normal pain? Is this not? What can I do? What about the brace? What about this? Should I unlock it? And so I think like telling people up front, like, hey, like, I don't want to waste your time and your money, but I think you really need me quite a bit on the front end. And like Mike had just said, you know, as we get farther out, like you can work out on your own. You don't need to sit here and watch me do, you know, a bunch of clamshells. Like you can do all this stuff on your own at home. Let me just use my expertise of creating a program for you at that point. And then we'll go once every week, once every other week, or whatever else it is, via, you know, email, Google Docs, stuff like that.
Yeah, but they had to like earn the right to go once a week or every other week, right?
Correct.
It's like, again, almost the opposite. Think about it too. I think like we underestimate. We're just like, it's isometrics and passive range. Like that's easy, right? But that's probably the time frame where their head is spinning. Right. They were, you know, they woke up and they were hungry one morning. They're like, did my surgery fail? Right. Like, I mean, we deal with like so much aspects of like the mental side of that. They have so many questions at the beginning, so many things that we take for granted that I think just being with us helps settle them down quite a bit. So,
and
what do you think?
Also,
Lisa?
I was gonna say, just access to us too. Sorry. Just like for us, I know all of us, we are text message available. So like if somebody, once we get them in and we know what they present like in their surgery and their personality, they can text me on a Saturday or a Sunday, and people do. They don't abuse it, but like if something's wrong and they feel like something wrong, I have to kind of talk them through it. And so that access, I think, is critical too, and people appreciate that. And I think that's part of the value add that we provide. Sorry, go ahead, Lisa.
No, I mean, I was just gonna say, like, I feel like I am still learning all of these things. You know, I feel like this has been a hard thing for me. And granted, I don't have a ton of like immediate post-op people at the moment, but this is definitely a hard piece of transitioning into cash, just understanding everything that we've already talked about. And you know, I feel like I always default to you all when I don't totally know exactly with a particular person, like what frequency. I'll be like, hey, what would you do? And like, it's, you know, it's just been very helpful to be able to do that.
Yeah. So reach out, right? Maybe Dominic, like you get some other people to help. Hopefully this episode helped, right? A little bit, like to give you a little bit more, but like, I think that's good advice from Lisa is, you know, try to have a network of some peers or something, or some mentors that can help you answer those questions. The transition to cash is weird. We've all been through it. We've all, you know, everybody on this podcast has been through it, and we've all struggled with something, right? We struggled with lots of aspects of that, and it takes time, but over time you'll realize, wow, like I'm delivering an exceptional value that people really want and people really, you know, expect. I think that's great. So, so keep that in mind. I think that's the goal. Remember, they're hiring you. Think of that, Dominic. They're hiring you to fulfill their functional goals, right? Just lay out a plan that you think is going to do that as quickly, as safely and as possible. And that's what they're paying you for, right? And then let them figure it out. If they have restrictions, then you start trying to manage that, but don't assume. I think that's a great synopsis of this episode. So awesome. Great question, Dominic. Good luck with your transition if that's what you're about to do. If you have questions like that, again, head to mikereinold.com, click on the podcast link, fill out the form, and we will answer away. We love getting all these amazing questions from you guys. So thank you so much for that. Head to Spotify, Apple Podcast, rate, review, subscribe, and we'll see you in the next episode. Thank you.